For the 3 spots, there's a vastus lateralis, the hand above the knee, hand at the groin, and not on top, and not on the side, but like right here. And it's like a 20 or 25 gauge needle for all 3 locations. The vastus lateralis can have up to 3 mils and a 1 to 1.5 inch needle. And then the ventral gluteal, I'm gonna do for my video, but it's also 20 to 25 gauge, up to 3 mils and a 1.5 inch needle. And then the deltoid, you find the bony prominence, and you go 3 or 4 fingers down, and you give it about like right here. And that's up to 2 mils, a 1 to 1.5 inch needle, and 20 to 25 gauge. Hi, I'm William, and I'll be your student nurse today. Can I get your name and date of birth, please? Jordan Nelson. Do you have any allergies, Jordan Nelson? Yes, seasonal? Okay. Looks like you'll be getting penicillin 900,000 units intramuscular in the ventral gluteal. This is my first check. Penicillin G procaine, injectable 600,000 units per milliliter, expiration date for 2031. So the patient needs 900,000 units. So 900,000 divided by 600,000 is 1.5 milliliters. I'll be assessing the ventral gluteal spot of the patient. So it'll be the bony prominence, or the greater trochanter, and put the palm on the, and it'd be like up here. There's no lesions, no scarring, no bruising, no signs of infection, and there's no previous injection there. For my supplies, I'll need a Band-Aid, a gauze, gloves, two wipes, a 3 milliliter syringe, the 19 gauge 1 inch for my drawback needle, and then a 23 gauge 1.5 inch needle. This is my second check. Penicillin G procaine, 600,000 units per milliliter. They need 900,000. Expiration date for 2031. And then hand hygiene, I guess, before putting on my gloves and doing aseptic technique. First, wipe off the top of the vial for about 15 seconds, or at least 15 seconds. For this video, I'm gonna pretend that's 15 seconds. gonna draw back 1.5 milliliters of air. I'm gonna get my bubbles out.
Wait, turn it. You have to turn it. Yep. Okay. Yeah.
Now for the sake of the video, I'm gonna put the solution back in because we can't inject into the mannequin. I'm gonna draw back 1.5 milliliters of air, but it would be solution. Now I'm gonna do my third check. Penicillin G procaine, 600,000 units per milliliter. They get 900,000 units. Expiration date 04/2031. Now I'm gonna get my client into a comfortable position. Let's see. Now tell the patient that I'm gonna give you your IM injection in your ventral gluteal spot. It's gonna be a slight sting. Find the greater trochanter, put your palm on it, and find the top of the iliac crest. And then she's abnormal, so would go in front, so about right here. And then we wipe from the center outwards for about 2 inches. gonna mark my spot. Now it's just air going in. First, I'll Z-track the skin away. Then on count of 3, I'll poke, and there's gonna be a slight sting when the medication goes in. First, I'll aspirate for any blood. If there's no blood, I can inject at 1 milliliter per 10 seconds. For the sake of the video, I'll pretend that this is 15 seconds. And then I'll release it, put pressure on with the gauze, activate my safety guard. Then I look to see if there's any bleeding. If there is, I put a band-aid, but there's no bleeding. Then I'd monitor the site for any reaction to the injection and help my patient get back into a comfortable position. I document the medication dose, time, date, route, and site I use into the MAR.
Good. You want me to stop it?